Well, the start of the year, it seems like a lot of people focus on their physical health, and we need to focus on our mental health too. And joining us today, we've got Adah Ellerbrock. She's with Coleman Regional Development. She is the director of Coleman Services, and she is going to tell us more about mental health and how it's essential. So thanks for joining us, Adah.
Yes, thank you. Thanks for having me.
Why is it that we always think more about physical health and maybe not so much about our mental health?
I believe it's because we can't really see like the actual, I guess, mental illness. You can see the effects of it, but sometimes it's past when it's already started. So when you have a broken leg, you can see the broken leg. But when a mental illness is coming into play, whether it's depression or anxiety, it comes on slowly. And then the effects of it are seen later. And that's when we need to start getting help.
Right, yeah, and we need to think about our mental health, right? And not be afraid to ask for that help and to get the help, whatever form it is.
Yes, that is true. Yes, there's so much stigma around mental health because in the past, it was seen as something that was demonic or something that was evil instead of actually being something that was a disease. So it was always played off as, nope, this is something that's not something we can actually handle. And there's been so many advances in mental health and how to fix it and how to treat it. And that's where we need to get rid of those stigmas and try to get rid of some of the words that come around it. Like, don't say, okay, that's so crazy, because that comes into mental health, or I'm OCD. Putting labels on it doesn't help with breaking the stigma.
Right, yeah, and we're lucky in our area, right? There are so many services offered in Allen, Auglaize, and Hardin counties, right, to be able to help with whatever we need.
Yes, and there's a lot of providers that are sitting underneath the mental health board, and they are doing a phenomenal job to help see what's coming in the trends of mental illness. There may be something that's in a peak, especially coming around the pandemic. There was more anxiety and more depression that came around it. Mental illness isn't always something that is chemically imbalanced. Sometimes it is your environment. Sometimes there's a trauma that peaks it. And that's where the mental health board keeps an eye on what's happening and then helps with providers like Coleman Health Services to reach out to those that are in need.
Right, yeah, and you know, whatever it can be, because I mean, I think a lot of times people think, well, I just have anxiety and I can handle it myself. Well, sometimes that's true, but you should not worry about getting some help from something that like Coleman or whoever can provide for you.
Yes, it's okay to not be okay, and it's okay to ask for help. If we had a cold or if we had a broken bone, we would go to get help immediately. We need to do the same. And like I mentioned before, the mental health board has a lot of resources, and one of them is a mental health screening. So if individuals go to wecarepeople.org/screening, they'll be able to take a screening on many levels. They can do it on their overall mental health. They can do it just on anxiety. It could be an eating disorder. It could be depression. So taking those screenings lets the mental health board know these are some things that are on the rise, and we can get some information out in the front of the community instead of waiting until it becomes a pandemic.
Right. And another good tool is the Hope Line, right?
Yes, the Hope Line is a very good tool. I noticed the other day there was quite a few people just curious about different things, whether it's depression or curious about suicide, knowing what people know. When people do that, they're not asking for our opinions on social media. They're asking for help. And so if we can put the Hope Line out there, which is 1-800-567-HOPE, that gets everyone the help that they need. Now, it doesn't have to be a crisis situation. It could be, I need someone to talk to. And then that's where the Hope Line comes into play. And then they'll get us into the right services.
Right. Yeah. So there's just so much that we can do to help with our mental health. And are there certain signs that we know that, like, for ourselves or maybe even family members that we're like, hey, call the Hope Line or do this?
Definitely when they're asking for help, when they're talking about it. Let's talk to someone together. Don't leave someone alone, especially if they're mentioning suicide. Say, what can I do to help you until we get the right resources? So stay with them. But also, if you see them withdrawing from things that they normally are excited about and doing, if they change their eating habits, if they change their drinking habits, if they change anything that's not in the normal, that means something's going on that we can't see on the outside. We can't see the broken bone. And that's where we want to ask for that help.
Right. A lot of great tips here, and take care of our mental health. It's essential to us. Adah, thanks very much for joining us.
Yes, thank you so much, Holly.
All right, don't go away. Noon Edition continues in a moment.